But then again, we are partly to blame. Is it not strange that in a country whose constitution speaks of the directive principles of state policy, we find a government commencing building of new health facilities when the previous facilities started by the previous government remain uncompleted? How have we as citizens become so divided and supine that we fail to stand up when things like this happen, knowing very well that the main driver of such schemes is procurement and sometimes sleaze? This is a major contributor to the waste we see in our health infrastructural projects, and perhaps a major contributor to why health inputs yield marginal outcomes. When they try to compare their performance in health, our politicians elect to compare with the performance of their opponents, not with the performance of countries with similar GDP or health expenditure per capita. So whilst they keep themselves busy, shouting themselves hoarse, as we look on, we slide down the global rankings of most health indicators, whilst countries like Rwanda rise rapidly. They behave as though we are in a race to the bottom. Yes, I would be the first to acknowledge that there have been improvements overall in most of our health outcomes in the last 3 decades. I also acknowledge that achievements such as Ghana's expanded program of immunization and guinea worm eradication, which led Ghana being declared free of the disease in 2015 by the WHO, are examples of what good looks like.